We're joined live by Dr. Chris Simpson, Executive VP and Chief Medical Officer for Ontario Health. Dr. Simpson, thanks so much for taking the time to speak with us right here on CP24.
Good afternoon.
Okay, hoping to get some clarification from you. We're hearing from critical care doctors like Dr. Michael Warner who say Ontario is running out of pediatric ICU beds, that there are 112 pediatric ICU beds in this province and 122 pediatric ICU patients in Ontario. So more pediatric patients than beds. Are you able to confirm that?
Well, the number is correct, but it's always very fluid. The number of patients in pediatric ICUs has been steadily climbing. But we have a phenomenon called surge capacity where when there are, during flu season or respiratory virus seasons, we're able to create more spaces and more staff spaces for kids as they need them. So the number is certainly high and going higher, but it's very fluid and changing every day.
Okay, so the number is high, going higher. You say in Ottawa, a very concerning situation there. CHEO, a children's hospital, opened a second pediatric ICU amid what they're calling unprecedented demand. How do you characterize what is happening to our healthcare system right now?
Well, certainly on the pediatric side, I don't think we've seen this kind of respiratory virus season, certainly in my 25-year career. We're seeing, as you know, a very unusual year where on the pediatric side, it's really not so much about COVID, but it's about this virus RSV and flu. So the more kids that come in with these illnesses who require hospitalization, we're finding room for them. But that necessarily means we have to slow down or stop some of the other things that we do in healthcare, like scheduled surgeries.
So some doctors have expressed concern about this. Could we see a triage situation in which adults are turned away because infants require critical care? How close are we to that potentially happening?
I think one of the things about our healthcare system that I have a great deal of faith in is that when a sick patient comes through the door, the system does everything that it can in the moment for that patient who needs our care right now. I think where things get dialed down in pressure points like this are in things like scheduled surgery, things that can be safely deferred. So that's the kind of dynamic I think that we're seeing right now.
But at what point does it really start to impact patient care for everybody in the province?
Well, I think it already has, in that if you take CHEO, for example, they've converted their medical day unit into more ICU bed spaces. So that means that the activity that's normally done there can't be done. Scheduled things get deferred. We've seen this earlier in the pandemic. I think people are familiar with that phenomenon. But very sick people and urgent and emergent care continues. That is always prioritized.
What is your message to parents, doctor? Where should you be taking your child if they're sick, if you think they have a virus? What do parents need to know at this time?
Well, I think the most important thing, and it would be, I think, for me to echo some of the messaging in your introduction, which is it is time to start wearing masks inside. That's how respiratory viruses can be dramatically slowed down. COVID vaccination and flu vaccination for your kids, if they're eligible, is going to help. The flu vaccine is a good match this year for the circulating variant of flu. And of course, any worried parent who thinks their child is in some distress needs to seek medical attention. The emergency departments are there for them. We also have clinical assessment centers. We have cough, cold, and flu clinics. And of course, primary care. So all of those doors to the healthcare system are open.
So I heard you say that it's time to start wearing masks indoors. Is it time to bring back a mask mandate? I mean, the calls for that to happen are only getting louder as we grapple with this triple threat situation: COVID, influenza, RSV, as you highlighted. So is this how we save an already strained healthcare system, by bringing back masks?
Well, I'd rely on my colleagues in public health to make the best judgments there. But certainly what I can say is true from a medical point of view is that wearing masks diminishes the transmission of viruses. That is a tried and true fact.
Okay, we'll leave it there. Dr. Chris Simpson, Executive VP and Chief Medical Officer for Ontario Health. Thanks so much for taking the time to speak with us. We know you have a very busy schedule, so thank you.
I appreciate it. Thank you.